I'm Jim Decuda. I'm the team leader for the Street to Home program. The team I work with were mandated to support people sleeping rough transition into hotel and motel accommodation. This was done to ensure that people sleeping rough who were vulnerable on the streets were able to maintain social distancing as part of the state government funded pandemic response. At the onset of that, a number of hotel rooms were made available for this response, and our staff actively went out, engaged with people, educated them about why this response was necessary, and then we supported them and brokered them into hotels.
My name's Leanne. I'm one of the nurses in the Street to Home team. We work in an outreach capacity out to food vans and public space to run nurse-led clinics and link people into services. When COVID first hit, we had to adapt our outreach service to incorporate hand washing initially and widespread education. So the teams were outreaching to the food vans to provide hand washing, also to boarding houses to provide education and supplies to facilitate hand washing and hygiene, and also to people that were vulnerably housed.
Getting a large volume of people off the streets came with a lot of logistic challenges for our organization. For instance, once people were off the streets, and given the fact that a number of services had actually shut down in Brisbane, so there were areas of deficit where accessing food, healthcare and medication was quite a challenge for this population and for our service. So we internally started doing meal distributions through our Hope Street Cafe, our social enterprise, and where we provide quite a few thousand meals across that short period of time. In addition, our nurses were providing healthcare directly to people in the hotel rooms, and we also supported them linking up to the new provision of telehealth with GP services. Over a period of 2 months, Micah Projects supported 800 to 900 people transition off the streets into hotel and motel rooms. Now, the challenges that this came with, communication was a critical part of it. Restructuring, organizing our staffing resources was another challenge that we had to very quickly implement and ensure that the resources were available to staff in order to do their work to meet the needs of the population in hotels. So while we were restructured internally to meet the needs, we also found that there was a willingness across government and departments and across the other community agencies to come together on a regular basis to discuss how, as a whole community and government, that we could actually continue to work with this population and the types of communication that we needed to actually disseminate amongst each other on a daily basis.
With COVID this year, brought the opportunity to provide free flu vaccinations across hotels and boarding houses and people's homes. And we had this in mind of something we wanted to do after observing the high rates of influenza A over the winter in 2019. So we wanted to avoid the increase in hospital presentations this winter alongside COVID. So it gave us a great opportunity to be able to do that.
So what has been a point of learning and what has brought also some insight and awareness is the capacity for our agency, for our community and for government to come together in a situation, a pandemic situation or a disaster situation, and work with great willingness to meet the needs of some of the most vulnerable people in our community. They've given generously, volunteers. Our staff have worked above and beyond the call of duty, and government's willingness to very quickly make available funds and resources to us to keep responding at the rate we were. The challenge for the future is, how do we keep that momentum going? How do we continue to work and communicate with each other? How do we bring that willingness to actually to work more strategically to meet the future needs of this population?